Thank you for joining us today for another edition of Conversations with AARP. I'm Troy Deshabere Schuster, your host and State Director for AARP in the Virgin Islands. Today we are discussing a crucial and concerning issue that affects many Virgin Islanders, especially those aged 50 and older: Medicaid, as the unwinding continues. For those who may not be familiar, Medicaid is the nation's largest health insurance program, covering nearly 80 million people, or more than 1 in 5 Americans, with more than 25,000 of those people living here in the territory. For many people who have low incomes, a disability, or who are very young or elderly, it's a vital program, often referred to by many as the unsung hero for Americans with little to no healthcare coverage. During the pandemic, the federal government created continuous enrollment requirements for Medicaid beneficiaries, including those living in the Virgin Islands. This ruling allowed them to retain their coverage through the last month of the COVID-19 public health emergency. In addition, it allowed for individuals to enroll in Medicaid without the usual income or eligibility factors, ensuring access to healthcare during unprecedented times. During that time, the enrollment grew significantly to 38,000 members in the territory. A year ago, when we learned that the public health emergency was ending and the Medicaid unwinding period was announced, AARP raised concerns about the impact on Virgin Islanders. We discussed this in an episode with leaders of the Department of Human Services, then Commissioner Causey Gomez, and Medicaid Director Gary Smith. Today, a year later, we remain deeply concerned about what this means for our community, especially our older Virgin Islanders, after learning that approximately 16,000 individuals have lost Medicaid coverage. Today we have with us Gary Smith, the Medicaid Director at the Department of Human Services, to help us address this concern and discuss where we go next. Together we will uncover what has transpired, where we currently stand, and what the future holds for Medicaid in the Virgin Islands. We'll explore the impacts on our community, the ongoing efforts to support those affected, and discuss the path forward. So let's start this discussion by introducing our guest, Gary Smith. Welcome, Gary.
Good morning. Hi, Troy. Thank you for having me again. Always a pleasure to be here with you and the membership of the AARP.
Yeah, thank you for being with us. And I know this is such an important topic throughout the territory. I'm sure that you are bombarded with questions and complaints and concerns from people of every sort. And hopefully, with you being on the show, we'll get the word out to the wider community and help to answer the questions of the community. So first of all, Medicaid 101. Tell us the difference between Medicaid and Medicare, because I get that question a lot. A lot of people seem to be confused between Medicaid and Medicare. So let's start there.
And thank you for that question, Troy, because there is always the question. As a matter of fact, some folks call our program Medicare. So the difference between Medicaid and Medicare is Medicaid is managed and administered by the federal government and the state or territory. It's a collaboration between specifically the Centers for Medicare and Medicaid Services and that state. In our situation, the U.S. Virgin Islands. Medicare is administered by CMCS solely, 100%. The state or territory has no um, contribution or involvement in the management of the Medicare program.
Okay. And so again, Medicare is for those individuals who are over a certain age, 65 or older, but
Yes,
Medicaid it could be for anybody.
yes, but a blind and disabled young person can be eligible for Medicare.
Oh,
The requirements are, stringent, but it is possible to become eligible for Medicare uh, younger than 65 years of age. But you are absolutely correct that Medicaid is the program that addresses the needs for someone age zero uh, and up until um, you know uh, your life here on earth. And also, I would like to say happy birthday to Medicaid, because today is the birthday of Medicaid, 50 years since it was, by law established by our Congress back in 1965.
excellent, excellent. Happy birthday to Medicaid, and certainly well needed and has done
Yes,
wonders for so many
yes.
people, saved so many lives, and we need to make sure that we keep it going in the right direction here in the Virgin Islands and all across the country for that matter. And so now there are two overarching issues with Medicaid that also confuse many people. First of all, with the Affordable Care Act, otherwise known as Obamacare, there was an expansion of Medicaid in the Virgin Islands, correct? And then we also had a different set of rules regarding the pandemic. So, if you could take us back to the Affordable Care Act and how Medicaid was expanded here, and then compare and contrast that to the new rules that came out as a result of COVID-19 pandemic.
Okay, so great question. So the Affordable Care Act enabled our Medicaid program here in the territory to expand. The expansion included being able to provide benefits for single adults. We also able to increase our income threshold, and then there were various expansions in terms of moving our eligibility and enrollment process to modified adjusted gross income, or the MAGI, which was mandatory, by the way, um, uh, based on the Affordable Care Act. Uh, we did not qualify to join the federal marketplace, which is a resource that the state Medicaid programs have. Folks that live in the states, they can, if they don't qualify for Medicaid, they can enter that portal and obtain healthcare coverage with certain plans that participate in the federal marketplace. And then also we could not garner or generate interest from any plans, insurance companies, to have their own marketplace. And there's also the federal marketplace. Then you also have alternative benefit plans, which we do not have access to as well. Move forward to the pandemic, we were allowed to offer automatic extension for folks currently on the plan, and we're not allowed to remove anyone during that period. Now, even, uh, go back a little further, back to the two category 5 storms. Subsequent to the storms, CMS waived our requirement to perform full applications. Folks were allowed to become eligible on self-attestation, like we do with presumptive eligibility at our hospitals and FQHCs. And those folks got on the plan. Then the pandemic hit, so not being able to remove those persons off of the rolls, thereby getting up to 38,000. As a matter of fact, we almost got to 40,000 members at one point in time before we began the unwinding or performing redeterminations and or recertifications. That's the meaning of unwinding.
Okay, now before you go forward,
okay, go ahead.
Before you go forward, let me interrupt you there.
Mm-hmm.
When it came to the Affordable Care Act,
Mm-hmm.
right, we have heard this talk about the Medicaid cliff that's eventually coming. Now, if you can compare and contrast that quote unquote Medicaid cliff with the unwinding as a result of post-COVID-19 Medicaid.
Okay, so the Medicaid cliff was where we were facing not having enough funding, but then also a desperate federal Medicaid assistance percentage, or FMAP, which back then it was 55-45. Our FMAP is now 83-17, and that was set permanently when the under the Consolidated Appropriations Act passed in December of 2022. So the Virgin Islands, along with the 3 Pacific Island territories, or the insular territories, have a FMAP of 83-17. Puerto Rico, under the same Consolidated Appropriations Act, their FMAP is 76-24 for 5 years. So their FMAP will come up for consideration again in the next 4 years. 4 years, yes.
Okay, now, again, sorry to interrupt you, but I need to keep this really simple so that our audience can understand it. So when you talk about FMAP, you're talking about the matching, right? So these percentages is a certain percentage paid by the Virgin Islands government and a certain percentage paid by the federal government, right?
Yes.
Okay.
Yes, and the Virgin Islands percentage right now is 17%.
Okay.
During the COVID pandemic, our the Virgin Islands percentage was 10.8%, because we received an increase from the federal government of 6.2 on our federal side. So the federal was paying upwards of 89.2, and our requirement was 10.8. And that all ended in March of 2023. And we began our redetermination process for all of our members in June of 2023. So you're absolutely right. We're 1 year. We're 1 year later after we began that process.
Okay, so the FMAP currently stands at what for the Virgin Islands?
83-17.
So we're paying 17%. Now, will that continue indefinitely, or will this cliff then change it back to the 55-45?
That is permanent. Under the CAA, that became permanent for us.
Okay, great. So now let's go back to the unwinding as a result of COVID-19.
Mm-hmm.
So, so just reiterate very briefly what the unwinding is and how are we dealing with that now? What are the effects of it, and how are you working through that unwinding?
So the unwinding is we are now mandated to perform redeterminations for everyone. As I mentioned, earlier, we were allowed to provide automatic benefit extension. No one had to submit documentation. We were automatically extending our members' benefits. And that this was something that CMS did to ease and ensure access to care for everyone during the COVID pandemic. So that has now ended. So we are now performing redetermination. So members are required to, complete an application, bring in all of the necessary supporting documents, which are required to be redetermined and requalified to be eligible for the program. So we have had approximately 16,000 of our members fall off of the Medicaid rolls for various reasons. And a couple of those reasons are some folks have not just submitted their redetermination or recertification information, have not completed the application and submitted the documentation, or some have fell off the rolls due to being over the income threshold, and then also due to certain circumstances as to why they are no longer eligible. So and we also are are experiencing a backlog, um, and as of this morning, we are at now 21,830 members. But I would say, with confidence, when it's all said and done, we'll probably be at 25,000 members, 25 between 25 to 28,000 members, or so, as far as Virgin Islanders being eligible for the program. And that 21,830 is approximately 25% of our current population based on the 2020 census that Medicaid is providing healthcare, access to healthcare for Virgin Islanders.
Yeah, that's a significant portion of our population. I was
Yes.
just about to say, I think that's about a quarter of our
Yes.
population. So that you
Yes.
confirmed.
Yes. Most definitely.
And so are people starting to come in to requalify? Is the word getting out to the community?
Yes, leading up to the unwind, we did several. As a matter of fact, one of the shows we did was your show. Um, we have posted posters across the all islands at pharmacies, grocery stores, doctors' offices. Numerous press releases, utilized our social media platforms, YouTube, Facebook. Also produced a couple of videos, um, and it's something that is a trend across the nation. What we are experiencing here in the Virgin Islands, other Medicaid programs are experiencing across the nation. We have something that's called churn. Churn is where we have members that, when there's the need to access healthcare, they will come, apply, you know, um, get certified, qualified for the program, become a Medicaid member. After those services are completed, you know, their membership expires. They don't renew or they don't recertify until the need, um, uh, you know, the need for them to access healthcare again. Uh, then that's when they come to recertify or well, then they will have to reapply because their benefits have expired. So that's another example of persons falling off of the rolls. um and again, these are trends that are happening nationally. um you know as we are challenged right now, financially, locally, so are our programs, our brothers and sisters in other um, jurisdictions on the mainland as well.
Talking about the financial challenges now, um, we have all heard of healthcare providers not being paid by Medicaid, and it was in the news that Medicaid didn't have the money to make the match. Um, and then the government appropriated some funds. So where are we with that now, and what is the outlook, for the future? What's going to happen next year and the year after with that?
Thank you for that question, Troy. So yes, the payments to the providers have been slowed. We worked with our senior leadership as well as the governor's office and also our legislature. We went before the legislature on June the 24th and testified. Uh, they approved an appropriation of $3 million. You know, we have recently received those funds and are now working with our Office of Management and Budget to ensure that those funds are deposited into the right accounts to get our providers caught up with payments. Um, you know, we've also had to go back to pre-COVID. I'm sorry, yeah, pre-COVID, where we're requiring referrals and prior authorizations for certain services. You know, we have to, uh, for a lack of better word or term, reel the program back in. Uh, we wanted to ensure during COVID-19 access to care, no issues because of the situation that we were faced with. We are now past that, and we are, taking a look at having to ensure that we budget in the right areas to ensure that access to specific care is available for our current membership.
But again, the outlook, that $3 million is like plugging a hole in the bottom of a sinking boat, right? I
And
mean, that just
and
helped for a moment. What's the outlook with that?
so reinstituting the prior authorization and referral process, we have the opportunity to ensure that there's not any waste, um, as far as services um, that are required and not just being, provided. So I think we will be in a good space, come to the end of the fiscal year, and we are definitely working on improving our policies and procedures, um, looking at placing limits on our dental program, where we found that we've really been paying a lot of um, funds for services that may not have been required. So those are things that we're taking a look at on our drug program, where we can replace a brand medication with a generic. We're utilizing that opportunity. We're also currently started a project with our pharmacy benefit manager to enroll eligible persons into Medicare Part D. Thereby, Medicare would be the primary payer for medications for those members that are eligible, as well as our buy-in program, where we can also enroll eligible persons into our buy-in program, where we would pay the Part B premium. Thereby, Medicare would be the primary payer for services that are being rendered to those eligible members.
Well, great. I'm happy to hear all of that. That sounds like really good concrete steps toward ensuring that the program doesn't fall behind financially in the future. Really, really important big steps.
Well, see, these changes were necessary, and when I say that, specifically going back to the prior authorization and referral, to ensure the viability of the program and that it, will sustain um, for our underserved population. We know that there are still a lot of members out there that are eligible, and we need to get those persons enrolled. But then also, look at increasing our income threshold. There is some room that we can increase our income threshold to bring more people in to address some of the uncompensated care. But then we're also, as the representative of all territories on the National Association of Medicaid Directors Board, continue to work with CMS and Congress to remove the cap that we have on our program, where thereby Medicaid can, Medicaid finance a lot of expenditures in healthcare where we have, the territories paying 100% local dollars, and have Medicaid step in and finance some of those expenditures. So at least about 60% of those expenditures can be financed by Medicaid. But, we do not have that opportunity when we're capped. And last fiscal year, we ran up on our cap, which was 135.2 million. I think we received 135.6 million this fiscal year, and all of the financial projections show that we will run up on our cap again this fiscal year.
Okay, now we just have a few minutes left. Well, actually, a couple of minutes left. What do people need to know about requalifying or re-enrolling as we go through this unwinding?
So, we need folks to know we send out text messages to members prior to their recertification dates. We need them to pay attention to those when they get the recertification information, to complete their information, ensure that, the necessary certification documents, required supporting documents are included. You can go to our website, www.dhs.gov.vi, and, search Medicaid, and, we have in there what documents are required. We also worked with our vendor. They perform some robocalls. So there is a call center that our members can call into, and I will get that 800 number for you, Troy, and provide, so you and your team can have to share that call center number in the event that folks want to call in and obtain information.
Excellent. And is presumptive eligibility still going on in
presumptive eligibility is still available. That is another avenue to enter the program. So if you present to the emergency room specifically and you're uninsured, it's applicable for uninsured persons only. You are uninsured. It's a self-attestation process. No documentations are required. But then after, if you are determined eligible, work, with the hospital caseworker and also our DHS representative that's located at the hospital to become eligible for 12 months by getting them the necessary supporting documents, completing the application to become a Medicaid member for 12 months.
Well, great. We are out of time. One of our viewers on Facebook said, can you please send flyers to religious organizations as well? But Gary Smith, thank you so much for being on the show, and we hope to have you on a future episode of Conversations with AARP.
Troy, thank you again for having me, and thank you for the listening audience, and we will make sure to get those flyers to the religious organizations.
Excellent. Have a great day.
Yours also.